Start. Good afternoon, everyone. I'm Dr. Kanchan, pediatric consultant pediatrician and pediatric intensivist from Kamineni Hospitals, Hyderabad. Today, I'm going to talk about recurrent respiratory tract infection in kids. As from past few months, we have seen lots of parents coming to us with the concern that the kids are getting sick often. They're getting cough and cold with fever or without fever, recurrent cough, and without any difficulty in breathing. Every now and then, they are getting every week, they are getting better, and they're again getting in a week or so. So, why this is happening? So this is most probably due to the viral infection which is going on right now. The viruses can be different types of viruses like your adenovirus, influenza virus, parainfluenza virus. But why this winter season or this season only we are getting? Because last year also it was there. It is because of the phenomena called as immune death. Why this is happening is the kids from past 2-3 years due to corona, they were not exposed to any infection because they were not exposed to a crowded places. They were hardly attended any functions, or they went to a school or a daycare center. But as the corona passed and the lockdown is gone, everything is open. So they are going to schools, they are again starting their daycares, and they're mingling with the other kids as well as they're going to a lots of function. So here now they are exposed into the infection which they are not exposed previously. So this immune debt is what the when the kids are not exposed to the infection, the body doesn't know how to stimulate their own body to fight with this infection, and they come with this recurrent respiratory infections. So do parents has to worry every time they get this? No, they don't have to, because this is milder form. But if it is getting very like it is prolonging for a week or a 10 days or a 2 weeks, or the child is getting sick often, like once in like twice a week, twice a month, and they are getting very high grade fever like 102, 103, which is not coming down with a regular treatment with paracetamol or what you give ibuprofen, or the child is becoming drowsy, like the child is less active, not taking feeds properly, sleeping most of the time, and his whenever there is a fever or not fever, the hands and feet are very cold, then definitely you have to visit a doctor and you have to find out what to do. So how you can prevent these things? So you have to prevent by same as you know, it's a hand hygiene and your cough etiquette. So wear mask, avoid going to a very crowded places, and best thing is to use mask whenever you are going to a school, because this is a season. సో మరి స్టార్ట్ చేయాలా ఎక్కడి నుంచి నువ్వు మరి స్టార్ట్ చేయాలా ఎక్కడి నుంచి స్టార్ట్ చేయాలి స్టార్ట్ చేయాలి Good afternoon, everyone. I'm Dr. Kanchan Channawar from consultant pediatrician and pediatric intensivist from Kamineni Hospital, LB Nagar, Hyderabad. Today, I'm going to talk about a recurrent respiratory infection in kids. Recently, we have seen a surge in respiratory infection in kids. Parents are coming with their kids with multiple times. Like we have seen many parents coming 2 or 3 times in a month with a similar complaints of cough, cold, fever, with or without breathlessness. So why this is happening? As we have seen from past 2-3 years, everybody was inside. Because of lockdown, there was no school, no play groups. There was hardly a mingling or a gathering. But from past 1 year, we have seen everything is open, and now they are exposing to multiple infections. So why this is happening? This is called as immune debt. So whenever the child is not exposed to infection, the body doesn't stimulate the body to fight for that infection. So and they present with a recurrent respiratory infections. So when to consider this as serious or when to worry? So whenever the child is having repeated cough, cold, fever, if the fever is not controlling with normal paracetamol doses or ibuprofen doses, and it is more than 101, 102, not touching the baseline, if the child is being dull, not active, not playful, not eating well, or vomiting a lot, or the cough is troubling him at the night also, not able to sleep properly, the child is very dull and the hands and feet are very cold, then at the point you have to visit a hospital and he might require a further treatment other than the OP treatment. So why this is happening? As we know, this immune debt, because of immune debt basically. So infection, whenever there is an infection, the body will stimulate and fight for that infection. And every time, whenever there is an exposure, the body will react differently and it will be a milder form of infection. So whenever there is a first exposure, it will react very fast and the infection will be more. So, how to prevent this? The prevention is basically by putting a high hygiene, then giving your child nutrition properly, keep it is updated, keep your vaccination of your kids updated as per the age. Even the optional vaccine is important because it will not prevent, but it will prevent the complication of the diseases. And if the child is getting those infection also, it will be in a milder form, not requiring a hospitalization. So nutrition wise, give all the kinds of fruit, make sure the child is hydrated properly. And the treatment is basically you have to treat the child along with the fever medication and cough and cold medications. Most probably antibiotics in these cases is not required, and antibiotic is required only in a condition when the child is getting complication because of this recurrent cough cold fever which is causing you pneumonias or ear pain or ear infection multiple times, or which is not coming down and child is getting dull and there is an infection in the blood test, then only you should start the treatment with antibiotics. So prevention is basically by hand hygiene, using a mask, and avoiding the very crowded places where you feel that your child can get an infection. Thank you.